Hi everyone, thank you for joining us this evening. We've got Dr. Rob Silverman with us tonight, all the way from New York. And Dr. Rob, for those of you who don't know I see a few familiar names on there who have attended a few of our UK-based seminars and webinars in the past. Dr. Silverman is an Amazon best-selling author and he has been using our lasers for a number of years. So he is the best person to talk to about the clinical application of any Erchonia laser. So tonight we're going to focus on the FX635, which I like to call is our premium sort of pain laser. And Dr. Silverman's going to go into this into a little bit more detail. So over to you.
Oh, thank you so much for such a wonderful introduction. I really appreciate it. And without question, always happy to be talking to my counterparts across the pond. And without question also, the lasers have revolutionized my practice. I was just giving a weekend seminar and just got back late last night and was just talking about all the possible applications, all the great functions, and really the research and the application of patient outcomes is really what makes the Erchonia laser stand apart. And I'm happy I'm able to finally be able to do one on the FX635, which I will demo. So one thing I'm going to ask everybody, I see people popping on as we speak, please write some questions. Keep them musculoskeletal and light. So I'm going to emphasize today the lower back. I'm going to emphasize any joint, any muscle, and I'm going to show you guys how to use it on the gut. So let's stick to that because it's the first webinar that I've done with the FX. And then if you want to do some more eccentric, off-label kind of stuff, we'll come back for part 2, or we'll have a special little one-on-one conversation. So let's dig in. But I really want to go over what is a laser and how does it work, because it's always good to have a refresher. As we all know, laser is actually an acronym for the idea of light amplification by stimulation emission of radiation. A laser beam is a focused beam of light that emits photonic energy. The key to laser as a therapy is that the light beam can be tuned to specific wavelengths that are known to have health benefits but won't give off any heat that could damage tissues. So essentially, this is a laser through a laser diode with a line-generated beam at a correct wavelength for healing of 635. It is photochemical. It is not photothermal, which is a huge takeaway. The lasers work on your body through basic photochemistry. The branch chain effect in photochemistry means that a single photon of light can trigger a reaction in the cell that causes the emission of several more photons. These photons then trigger emissions in other cells in a chain reaction. The initial signal is multiplied and causes a rapid and regenerative flow of energy through the cells. So let me use this as an example. Let me see if this is vivifying for everybody here. Imagine for some strange reason, I've set up 18,621 mouse traps on a football field, your football field. I put a ping pong ball in each mouse trap. The mouse traps are your cells. I toss one ping pong ball on the field and hit a mouse trap, which goes off and shoots its ping pong ball onto another mouse trap. I set a cascade of bouncing balls. That's what's happening when the laser hits your cell. The chain reaction moves through that cell and the ones around it, stimulating the healing process in several ways. So using that example, the laser stimulates the release of nitric oxide in cells, which expands blood vessels and lets more blood through. That helps bring nutrients to the area and carry away waste products, especially the waste products produced by inflammation. For areas of the body that don't have good blood supply, like the discs in your vertebra, increasing nitric oxide is very helpful. The laser also increases cellular regeneration and cellular communication. Cellular regeneration occurs because the laser increases the production of ATP in the mitochondria of the cell, because ATP made in those little powerhouse transports chemical energy within your cells for metabolism. Increased production of it means the cell's ability to heal and regenerate exponentially. Lasers increase cellular communication by improving the ability of the cells to talk to each other with other chemical messengers. They talk to each other through the cell membrane, and they talk through nerve communications. As we know, the body is all interconnected. All of this helps the body coordinate its response to things like inflammation. So that's just a brief overview of what a laser can do. Let's dig into some more of the granular techniques. I'm a big Arnold fan. I'm sure he's big where you guys are. I love this quote. You can have results or excuses, not both. There's no excuse not to apply low-level laser in your patient base. And then once you do, you will get the results. You will optimize patient outcomes, as I have, and many of the other laser owners here in America. So Global Newswire, interesting. Cold laser therapy market is expected to generate almost $700 million by 2030 globally, and it's growing every day. More and more people are adopting laser into their practice armamentarium. To speak to integrating laser into practice, a very famous, well-known TV doc, if you will, called Dr. Oz, he's had the Erchonia laser multiple times on TV, and he called it the no-pill pain buster. I was on a more local TV and called the laser the most versatile healthcare tool of the 21st century. Versatile in the ability that all of us can get a very similar elite outcome. Versatile in that its versatility comes in all the different types of conditions through the different systems that it can help and attenuate inflammation and increase healing. Versatile in that some of the handhelds you can put in your pocket and carry across when I come. So I always carry one extra laser in my pocket when I come from America to the UK. So Erchonia is involved in American current research, projects, and collaborations. Number one, autism. And that's being used with, I'll just say, the 635. So we're going to have some autism studies coming out in the foreseeable future. Tinnitus or tinnitus, however you pronounce it. Some good studies, again, with the red light on tinnitus. Neuropathy, neuropathologies. Also, we're going to talk a little bit about small fiber neuropathology today. Erectile dysfunction, another one of growing concern here in America. Fat loss. So essentially, we have one of our body contour lasers in the Mayo Clinic, and they're applying some of their nutritional aspects to really enrich the outcomes. And lower back pain. We're always doing more and more things with lower back pain. The 635 nanometer FX laser has an FDA clearance amongst many, but one of the big keystone moments for Erchonia was, in fact, its FDA clearance for lower back pain. Toenail fungus, macular degeneration, severe spinal cord injuries. I will have a slide speaking to that. And for me, one of the big takeaways is, our oath is to do no harm. Let's take a look at this slide. Throughout the entire history of the company, for all Erchonia's level 1 FDA clearance studies, there have been no reported adverse events, reactions with any kind of laser treatments. I just completed another one. All the forms are going to be going in today. Again, everybody was extremely happy. There was no downside. So I attribute the no downside to the fact that it's FDA cleared, the science is there, and there's no heating involved. A lot of people always ask me, is laser the new thing? Well, I don't know if it's the new thing because it's about 119 years old. Here in 1903, Dr. Feason was awarded the Nobel Prize in Medicine and Physiology for working with skin tuberculosis and using ultraviolet light, 4 or 5 nanometers, believe it or not, and red light with smallpox. About 50 years ago, it really became more popular to use in offices, and it was the contemporary clinical practice of photobiomodulation, which is synonymous with low-level laser. So here's a doctor in Hungary who demonstrated its therapeutic benefits for wound healing. As a matter of fact, somebody else yesterday reached out for a burn, and a burn is a combination of a wound and an infection. And my understanding is the application has started in my office for some burn healing and wound healing. We've had some great results applying the 635 nanometer laser. So a lot of people ask me the big why. What are 5 reasons that you use the low-level laser? Well, number one, I find that it's effective. effective with the speed of light, photonic energy. It's research driven. Erconi has 20 out of 23 FDA clearances in the United States. Now, I know you guys there do not have an FDA clearance. The FDA clearance here is a really big thing. It's not inexpensive at all to get. It's actually quite expensive. It's real arduous. Being a lead clinical investigator on one of the 20 has really shed some light on how difficult it is to get. But once you have it, really imbues me with enthusiasm to want to utilize this device on my patient base. And of course, there's empirical studies. People where you guys are in the UK are reaching out to Simon. They're reaching out to me every day, not only with great questions, but already great case study results. It's practice building. You know, you can't do the same thing every day and expect the same result. We progress. I ask a lot of people, if you've been practicing 20 years, do you practice the same way you did 20 years ago? 15, 10, 5. So I can tell you that I'm always progressing. And one of the biggest progressions I've added is laser and treatments within the lasers. Of course, you're really going to have an improvement in joint health. It's made for joint health. And that's where, if you're a chiropractor or a manual practitioner, really you can hang your hat on. But I can tell you where the growing two spots are really. Number one, brain health, without question. Brain is a growing area of interest in a lot of our practices. And also, I probably should put a 5A, the idea of gut health. So in an epigrammatic fashion, what is low-level laser? Well, it's photobiomodulation. It's also low-intensity light therapy. Its effect is very simply photochemical, not photothermal. The photonic light triggers a biochemical change within the cell. Photons are absorbed by cellular photoreceptors called chromophores, and they trigger chemical changes. The best way to describe it, or you can compare it to for a patient, is photosynthesis in the plants is like using laser in a person. So let's look at some of the biological effects of cold laser and low-level laser therapy. Number one, photon absorption gets absorbed, allows for mitochondria activation. ATP production is increased, but efficient ATP production. So when you have efficient ATP production, you also have a decrease in some of the dirty gas side effects, which is reactive oxygen species. So let's take a look. What body part has the most mitochondria cells in the body? The easy answer is the brain. So when people ask, does it work for the brain? Clearly, because of its mitochondrial activation. All of this results in a stable, healthier cell. So people ask, what does the red light, 635 nanometer light, really do? Number one, it's a modulator. It increases energy flow and dissipates energy if it's too high. How do I explain that to patients? Very simply, if your muscle's too tight, it'll relax it. If your muscle's too flaccid and weak, it'll tighten it. It's got a compass of energy to allow the muscle to go back to the appropriate needed tone for health. The red light also promotes increased energy through the stimulation, as we talked about, of the mitochondria. It has an anti-inflammatory effect. It decreases inflammatory pathways like NF-kappa B. It enhances ATP production and protein synthesis with pain reduction. It creates an improvement in collagen formation and wound healing. It allows the body to reduce pain and muscle spasm while also increasing strength and range of motion. It does so in multiple joints in the area. The red light has a balancing effect on the parasympathetic nervous system while also enhancing microcirculation of both the blood and the lymph. And the red light allows for cell-to-cell communication. It ties the nerves or the peripheral nerves into an interconnected form. Rockheim has done studies and found that 635 nanometers was the secret sauce or the sweet spot for the connection and the healing of peripheral nerves. So just to review a little bit, I'm going to share some positive effects of the 635 nanometer wavelength. Obviously positive for mitochondria, positive for the cell and cell energy and ATP, has a pain relieving effect, allows for accelerated tissue regeneration, stimulation of cell metabolisms, accelerated wound healing, increased lymphatic flow, and stimulation of microcirculation. So let's look at some key laser therapy protocols for musculoskeletal injuries. And the big one that I really wanted to talk about, wanted to emphasize, I believe that most people on this webinar see more of this than anything else. That would be the intervertebral disc or intervertebral disc disease. As we know, a factoid. The IVD is the largest structure in our body without vascular supply. So once you injure a disc, it's a real slow haul to heal, and it's an even slower haul to get the nutrients inside the disc. So even if you were to, if you will, plug the hole of a bulge or herniation, it still takes a very long period of time to allow the healing to ensue. So of course, I recommend using low-level laser in this, but as we continue, let's look at the anatomy of the disc. You know, we talk about the disc like a gel-like substance. And it has gel, but it's not a thick gel. It's a very loose, watery gel because the nucleus is about 80% water. So we have to understand that it's probably not providing, when exposed, pressure to a nerve. It's probably providing chemical irritations. Now, when you look at the anatomy, the nucleus is obviously in the center. The annulus is on the outside. There's an inner and an outer layer of the annulus. The outer layer of the annulus has a construct very similar to bone, while the inner layer of the annulus has a construct very similar to the nucleus. That said, the outer layer has the nerve, so it's the 1/3 outer layer is where you're really going to feel the pain. The IVD, intervertebral disc, does deteriorate over years, and it goes from the nucleus outward. So it's influenced by multiple things, such as genetic inheritance, metabolite transport, and age-related deterioration, which usually is accelerated by any kind of physical disruption. Flexion in the lumbar spine is something that provides a lot of physical disruption to your lower back. As a matter of fact, studies have shown we get 28,000 flexions in our lifetime before we damage our disc. To put that in perspective, if you were to tie your shoelaces wrong every day, you would have a physical disruption of your disc by age 40, not including any other disruption, sitting, standing, bending throughout the rest of the day. And as we all know, most degeneration occurs in the lower lumbar discs between L4, L5, L5, and S1. So healing of the disc periphery has a potential to relieve discogenic pain by reestablishing a physical barrier between the nerves and the nucleus, therefore reducing inflammation. So surgically removed human discs have shown in studies that they have active inflammatory processes from the outside in. Effective healing only occurs in the outer annulus and end plate. Annulus or vertebral end plates can be sensitized by inflammatory-like conditions arising from contact with blood or the displaced nucleus propulsus. So here's my intervertebral disc protocol. Laser or laser at the point of involvement. This is with the FX635. Laser during movement. Even though you're in a prone position, which I use multiple positions with the FX635, there is still some movement allowed. You can do bird dogs. You can do Mackenzie extension. You can brace. Also, laser locomotor lock-in. After every laser and/or chiropractic treatment, if you will, I always do some sort of proprioceptive lock-in, and I think you'll find where you get a lot of bang for the buck is when you apply the laser in a proprioceptive setting. Some of the corrective exercises that I alluded to before are as follows. The McGill bracing, 360-degree co-contraction of your lower back. The McGill Big Four is very simple: a brace, a plank, a side plank, and a bird dog. I'm a big believer in hip flexing, stretching. That psoas is a critical element. If anybody wants, please put that up in the question. I'll show you how to deal with the psoas with the 635 in a very time-saving manner. And kettlebell swings teach you how to hip hinge. Core lock in, you always want to lock the core in. After a lower back injury, your brain shuts off your intrinsic support system that holds your spine in place, those local core muscles. So you got to reset your lower back. So you don't want to just treat the lower back. You actually want to reset it. I will share a nutritional protocol with everybody. You can clearly use myofascial release. I'm going to show you a multitude of ways when somebody's face down that you can do chiropractic treatments in concert with low-level laser. Clearly, you can mobilize, manipulate, flexion distraction, and clear any kind of joint restrictions. So as I said before, there's some studies being done on spinal cord injury. Here's one in 2017 that speaks to the idea of low-level laser allowing neurons to survive. Laser elevates interleukin-4 and interleukin-13. Studies have shown that low-level laser reduce inflammation, regulate macrophage microglial activation. Therefore, laser or low-level laser may be an effective candidate for the treatment of spinal cord injuries. Laser has a positive effect on pain relief and also decreases an objective blood serum marker called interleukin-6. Interleukin-6 is one of the most dynamic markers you can have on a blood scan, and without question, it was one of the most interesting inflammatory markers in relations to lower back and, believe it or not, COVID-19. So let's dig in. Let's look at low-level laser for chronic low back pain. So I do it a little differently than the FDA cleared studies. Everybody is allowed their little creative license, if you will. So here's Stephanie in a picture. We will turn the camera on in a few minutes. I will demo, I will answer all your questions. She's in a prone position. In that prone position, I'm applying the FX635 to her lower back. And that was between 5 and 10 minute treatment time. And she's in a supine position. She happens to be wearing her glasses on the left in a supine position, which is not a requirement because it's a class 2 laser. There's no damage with a class 2 laser. That said, I'm applying a laser to her lumbar sacral plexus and her hip flexors bilaterally. So changes in an analog scale. Here was a study that was done that allowed them to get an FDA clearance for the 635 nanometer laser, the FX635 on lower back. They had a sham group and a laser group. Make note, the laser was applied twice a week for 4 weeks. Take a look. Look at the precipitous drop from using laser up to 4 weeks, but look at that precipitous drop from 4 to 8, 8 to 12, and 12 to 16. From 4 to 16, there was no additional treatments, yet the laser was still decreasing the pain on a VAS scale. That speaks volumes to the idea that laser has a systemic effect and a systemic ongoing effect. Here we have Oswestry disability scores, and you see a relative flat line in the sham group, but once again, you see a dramatic drop into week 0 to 4, and it's still an increased drop in week 8 and week 12. So here you had an original study. The original study had people that had a pain duration of 98 months. The pain scores continued to improve almost 18% from 12 months post-treatment without any additional comments. So 1 year later, without any treatments, which is not something you and I would probably recommend, they were 18% better. Really resonating that the laser starts a systemic healing process in the body. In June of 2019, it was the 20th FDA clearance that Erchonia received. It was the first and only non-invasive technology to receive an FDA clearance for overall nociceptive musculoskeletal pain. So what does that mean to my patients? Any joint, any muscle in the body, Erchonia FX635 is FDA cleared for. So let's take a look at this FX635. It has an FDA clearance for, once again, the relief of chronic nociceptive musculoskeletal pain. It was a double-blind and placebo study with 255 patients. No other treatments administered other than the laser, 8 treatments in 4 weeks, a 49, we'll call it 50% average pain reduction. No other therapies used, as I said before. Where you can compare and contrast that with a study in JAMA, the Journal of American Medical Association, one of the most reputable journals that we have here, in a study of 119 patients, which implemented adjunctive therapies. If they took opiates, a year later, they were only 20% better. If they took non-opiates, maybe the NSAIDs, they were 26% better. So what does this say? Number one, we realized that pain meds don't work over a long period of time. And pain meds with implemented adjunctive therapies do not work as well as a laser in an 8-week period. So let's synthesize that and let's postulate that imagine a 49% decrease applying the laser, adding adjustment, soft tissue, acupuncture, taping, exercise, rehab, nutrition. Think of the outcome possibilities you have with people that had chronic lower back pain over a 98-month period. So some studies were shown that, again, we're piggybacking on the idea of interleukin 6 and interleukin 8. Interleukin 6 and interleukin 8 were positively affected by the application of low-level laser. So here are some of the low back FX options, FX 635 options you can have. I'm a big believer in the standalone and or synergistic with other treatment modality. So I call the standalone, set it and forget it. Just put it on that lower back, go in the other room, treat some other patients and come back. However, if you'd like to do it in conjunction with any kind of your treatments, here are some easy suggestions. Number one, you can do laser with myofascial release, laser with e-stim, laser with exercise rehab, laser with acupuncture and or dry needling, laser with decompression, laser with kinesiotaping. I've adjusted people under the laser. I've done instrument-assisted soft tissue mobilization like Graston and Factor, or any other kind of modalities. So the laser, again, is a great set it, forget it standalone, and it also works with a synergistic effect with any other kind of treatment modality. One of the ones that I really wanted to highlight was back pain and fascia. As we all know that fascia plays a role in back pain. Fascia is your interconnected system. If you were to take the skin from a chicken and pull it away from the meat, in between the skin and the meat would be this white film. We call that fascia. Fascia is the intertwining, allowing the transfer of movement from one region to another. It actually allows for the tightness in the body or the tensegrity. It also allows the ability for the body to slide. It plays a major role in back pain. Without any pain, you can slide up to 75% of your fascial limits. However, when your pain is present, your movement is reduced to about 50%. There's the frequencies, 9, 16, 32, 55, 955 to apply for the FX 635 if you have back pain from fascia. Here's a gut protocol for the FX 635. So when I say a gut protocol, what do I mean? Well, I do a lot of functional medicine, excuse me. And in the functional medicine, I believe that the gut is the epicenter of your health. I believe the gut to brain axis or the brain to gut axis is the superhighway to health. It's the key axis because it is your bidirectionality, and your gut is your second brain. So I do a lot of gut lasering, and now you're seeing a couple of different lasers applied to the gut region in an FX manner, in a set it and forget it manner. So concussion, and again, we'll demo some of these. Here's a concussion with an FX 635. On the left, you'll see Stephanie. She's the young lady wearing the goggles, and you'll see that I'm applying the laser in a temporal fashion. Whereas on the right in figure B, that's Kate. She does a lot of my rehab in the office. You'll see me applied in a mohawk type manner. So I'll do half the treatment, which I usually do 20 minutes on the brain. Some people can do 5 or 10, not a problem. And I split it and I move it to make sure that we expose all the areas and all the lobes of the brain. Here's another protocol. And again, we can demo that or open it up to some questions and demos as we're already over 30 minutes in the conversation. We'll do the gut to brain reconnection. So we can laser the brain, all diodes, FX 635, and I usually start on the brain in what we call the delta wave fashion, 11111, and then I will do a vagus nerve stimulation with the EVRL. So I do want to demo using the FX with an EVRL. I call that 1 + 1 = 4, because when you add those two together, now you're getting the compound exponential healing possibilities. So plantar fasciitis. one of the last conditions we're going to talk about before demos. Some facts. Number one reason for heel pain. Interesting, when you look at the anatomy, it's truly a misnomer. You've got plantar fascias on the left and the right, or lateral and medial. The plantar aponeurosis is in the center portion. And really, you look at that nerve, 70 to 75% of plantar fascia, or what we call plantar fascia, is plantar neuropathy. It's a nerve, the tibial nerve through the tarsal tunnel, that becomes the inferior calcaneal nerve in the heel. Symptoms are that it's the worst pain walking in the morning, very common, number one reason for heel pain. Overuse, ergonomics are causing it. Clinical assessment, I just had a patient come in today. I touched the medial tubercle. It was actually the muscles in the plantar fascia, and treatment, low-level laser, nutrition, and without question, some exercise rehab. So let's take a look at the plantar fasciitis laser protocol. 2 treatments were elicited per week for a 3-week period. These were done by podiatrists, foot doctors in the US. They hit the area of the top of the foot, the myofascial junction of the heel, and the plantar aspect of the knee. Interesting, they went for the dorsal aspect, and the reason they did is they wanted to stimulate the dorsal pedial artery. All were treated simultaneously because the FX635 is different than the handheld in that it has 3 diodes. Those 3 diodes have a 17.5 milliwatt power, and they are circulating. They did it for a 10-minute treatment time frame. So when you take a look at that, what's very interesting is here is the reported heel pain, in that there were 37 patients in the active group, 32 to placebo group. Patients had 3 months of heel pain, and they were over a 50 on the VAS. They had failed to respond to prescription NSAIDs and or 2 or more conservative treatments. The chart clearly depicts a heel pain rating on day 2, first step averages over placebo. Laser group decreased progressively. Placebo group returned almost back to baseline. So here we have this huge drop in day 2 heel ratings on the VAS from beginning to 6 months post-treatment, still improving from 6 to 12 months. Once again, you're seeing tremendous changes over duration of time of non-application of the FX635. And lastly, what you're seeing here is the plantar fascia thickness was significantly reduced in test group subjects, but not in sham participants. As a matter of fact, the placebo group's Achilles tendon got thicker. What does that mean? That means if the Achilles tendon group got thicker, the Achilles tendon was still trying to allow for a shear sharing, and that's what Achilles tendon does. It dispenses with force. Last thing before we turn on the camera. There was a pilot study on low-level laser treatment for acute and persistent discomfort. Low-level laser had a positive effect upon numerical pain ratings and reported function in adults with pain. Last, low-level laser's impact on small fiber neuropathy. Patients were diagnosed with small fiber neuropathy via epidermal neural fiber testing before and after. 12 treatments, 10 minutes per extremity, 3 times a week for 4 weeks. FX635 was administered. The directed diodes were at different parts: common peroneal nerve at the fibula neck, posterior tibial nerve at the medial ankle, deep peroneal nerve at the dorsum of the foot, superficial peroneal nerve at the anterolateral ankle, plantar aspect of the foot. They used a total neuropathy score that was a reduction to objectively evaluate each patient's response to laser therapy. The conclusion was as follows. For each patient in the study, there was improvement in the overall perceived pain ratings. In addition, participants exhibited on average of 75 improvements in neuropathic pain. So demo time, I'm going to turn the camera on. There we are. Hey, everybody. Vanessa, do we have any questions before we do some demos, and do we have any requests? I'm turning
Not
on
at the moment, but if anyone has any questions, please put them in the chat or in the question box and we'll get round to them.
Okay, so yep. So here's Steph. Here's Steph. Everybody knows her. So let's make this easy. Let's go right into the lower back. If you can go face down. Real easy. Set it and forget it. Boom, I'm done. Here's your set it and forget it model. Anybody have any questions on set and forget it? Once again, 3 diodes. 1, 2, 3. I'm going to turn one diode towards me. And in that, I'm going to lift it up for a moment. In that diode, you're going to see it circulating. I think I have to go more this way to get to circulate. So you guys can see it. It's circulating. So it covers a lot of surface area. So it's vastly different than the regular laser. Could you hand that one to me? It's right there. So when you see the difference, you see this laser is more straight, has its place. The FX 635 is a circulating, rotating, I guess is a better way to do it, diode. So you can see how easy the EVRL is. I'm putting it in my pocket. So we have 3 diodes. Each has a milliwatt of 17.5. We've got a center diode, and I'm getting the sides of her lower back. I can also get the sides of her hips. I can move it up. She's quite petite, so I can cover a lot of surface area. So that's number 1, set it and forget it. I'm walking away, you can't see me. So she's in the room for a 10 to 15 minute treatment. Vanessa, any questions on that?
Yep. Hang on. Hello, I know it will be slightly different per condition, but what is the average duration someone is lying under the FX per treatment?
It's a great question. So I'm going to leave her there. That's how easy it is. I like to use the FX in treatment times of about 10 minutes. There's some instances where I do it for about 20 minutes.
Okay, cool. Yeah, it'll just depend on the condition that you're treating.
Also the phase in which the condition is in. So if it's an acute condition, subacute, chronic, etc., which we have specific frequencies and protocols for.
Yeah, and obviously all of that's covered during training.
Right, it's all covered in training. Yes.
Yeah.
Are we good with that? Can I take it to the next step now?
For sure, yeah.
Okay, great. So now we talked about all the different things. So these are my imaginary. I took my stim unit out because I needed a little room. I can put my imaginary stim units or electric stim. I can use my imaginary wand and do ultrasound. I can use my imaginary needles and put them in acupuncture, dry needling. I can adjust her really quickly and easy. Can you go on your side? Yeah, towards me. I'm in here. So if I want, without any question, I would move it over here. And of course, and I can adjust her if I like. Really easy. So I can put her in a, by the way, since she's here, I can put her in a sideline position. I can put her in a sideline position. I can work soft tissue. I can go on the other side. I can work her hip area if need be. Could you flip towards the camera so they can see? So clearly I can work on her psoas. I won't stick my hand on your psoas. I know how much you love that. So we'll mimic a psoas. I can do a psoas release with my hand. Can you go face down again? And just bend your back up a little bit. Just bend up, you know, bring your head. Yeah, so she can do extension. She can do Mackenzie extension. You can go back down. I can tap her and teach her how to brace right over here. If I wanted to, I'm not. I could put her in a tabletop position. She could do a bird dog. I could have her on the floor if you want. She could also do a side plank. Any questions on the versatility within that, starting in a prone position, Vanessa?
Nothing at the moment, but maybe give people a minute to type.
Not a problem. Let's flip you over like a pancake. And now I can laser the gut and help with wound healing and any kind of leaky gut issue. So we'll start with that. I'll set it and forget it. I'm gonna walk away. Now I can also do a hip injury with the FX635. I can also do a hip and stretch her psoas. I don't think you guys can see me that way. So I'm going to do the hip over here, and I'll do the psoas reaching around. Can they see? Yeah, put the camera down. Great. So you can see that I'm stretching the psoas. I could put her on her side. I'm not going to do that, and pull back. Now, what's interesting is that I can do lower back, and all those people have an EVRL. I'm going to come to the head of the, look at all this. And I'm going to get the vagus nerve while she's down. So I'm going to do EVRL plus FX. I can also use the EVRL to laser her brain just a little bit. I don't think it can be. So I'll point to it.
I have a question.
Sure, go ahead.
How does this, what you're doing now with the Aconia lasers, how does this differ from obviously other techniques that can treat this type of condition?
You mean like shockwave decompression?
Yeah.
Well,
How would it differ if someone has that in their clinic or doesn't have that and they're just trying to understand how does it differ?
Well, laser works very simply by getting the photons in there and getting absorbed and stimulate healing from the body and the inside out. It works in synergy with decompression. My other room, I have a decompression, so I actually have a manual decompression. I decompress the lower back while I apply the FX635. So I found that to be very effective. Decompression works by creating a negative vacuum flow and trying to suck in the particular materials of the disc. I find that it's also very effective in that it's just putting in a plug here. It's very effective in that it also releases a lot of the muscles. So I believe you laser with all these.
Good stuff. That May.
She just walked by, yeah.
Sorry about that.
She's concerned that the laptop doesn't have enough juice, but it has more than enough, but it's fine.
That's good. No questions yet.
Okay. So again, here we are. We're doing again the gut. So I'm going to move it. I want to show you how versatile it is. So Steph, if you would be so kind to have a seat right over here. So I'm going to put her in a chair and you'll see that it works in a chair. Actually, I'm going to, you know, Steph, sit right here. I'm going to lower you. Good thing you're not too tall, though, is I would lower some more. So now she's getting a brain treatment right now. Piece of cake. Any questions on the brain treatment and the versatility within that?
Yeah, I got a question.
I figured.
If a client prefers to remain fully clothed, does this significantly reduce the efficiency of the laser?
No, it does not really, because do you guys remember the explanation I gave about the beginning about as long as one photon gets in, the mousetrap starts the cascade? That's the reason that I made sure that I incorporated that so people would actually understand that as long as one photon gets in. So there's 8.2 billion photons per diode per second, a lot of photons. So if she's wearing clothes, which she is, now obviously she has no clothes on her head or anything like that, you get what we call a scatter. You get a 90% scatter. In that 90% scatter, you're still getting 10% of that 8.2 billion photons. You're getting the cascade of the mouse traps. So is it better on skin? Yes, but we all know we don't all have the opportunity to apply skin in that manner. So therefore, it is not truly slowing down the effectiveness because you're getting photons in at such a high rate and a high number.
Great, thank you. I don't have any more questions just yet.
Okay, so she's here, she's getting a brain treatment. And at the same time, because we wanted to talk about the combination, you could take the EVRL and still do like a vagus nerve treatment. So here's a combination treatment. I could sweep the gut if that's what I wanted to do also. Okay, so now I'm going to move this very carefully and treat the shoulder. So here's a shoulder treatment. And because of the arm movement, which is so flexible, I can create enough room and move her arm up, her arm, and her arm. I can actually do a soft tissue release. You can make a face. I know it's not that comfortable. I'm right in a bicipital groove, docs. Any questions on that? Because look what we have here. The ability to treat the shoulder. And then again, if you really wanted to, you can reach around and do her brain. Are we good, Vanessa? Do you have any questions on this?
Same question with clients wearing thicker items like trouser belts.
Same holds. If you can get the belt off, great choice. If not, don't worry about it. It goes through clothes. There's scatter, but it goes through clothes. It's not like an ultrasound, I'm sorry, but it has to be skin on skin. Is it better with skin? It's always better with skin exposed, but you're not always going to have that opportunity with every client or patient and in every condition. It's just not realistic. I practice, I know that. Not everybody's going to give me skin. Does everybody see the placement? Everybody see all the versatility, the possibilities? So if I were to have her lay down again. Yeah, I'll bend it, I'm sorry. Okay, I'm gonna move the whoops. Sorry about that. I just pressed the button. So you can see that I'm now treating her knee. I'm now going to treat her heel and her foot. So I can do ankle sprain. I can do plantar fasciitis. I heard you click in, Vanessa. How can I help you?
2 seconds. Can Rob please speak about how it would help with low-level muscular tension, e.g. chronic trap or low back stiffness rather than pain?
Sure. It works. As a matter of fact, I prefer it for the lower back stiffness because if you remember from that slide, the first slide that we talked about, where we talked about that it was a modulator. A modulator of what? A modulator of too much tension or not enough tension. So therefore, for musculature, you know, the right tone, I think that's a question that you're asking. The laser works for the tone also. It doesn't just modulate the pain. It works for both muscle spasm, tone, range of motion, and strength. So it really cures a large sequela of musculoskeletal issues.
Great, thank you.
Good. So we're still, you can see it. We're doing the foot right now. So again, you see the versatility. Once again, while we're here, I can do anything I want with the EVRL and add it to that. I'm walking around and we got a few minutes left. So anybody else have any questions? Anybody want me to treat something to show you I got? Thank you.
Anyone want to put any specific things?
Keep it musculoskeletal, ladies and gentlemen. Let's stick to that.
Yeah, because we can go on and on about loads of different conditions, which we can definitely do a part 2 about something more specific. If we keep it more general.
I don't mean to interrupt you. What I suggest is I think part 2, because I know we've
Yep.
talked about doing something different. Part 2 would be to send in your case studies, and I would address them over the hour, and let's go through some different things. When the case study would be the 635 with the EVRL and or some case studies and say, hey, I had lower back. It didn't respond in this. I could show you how to do the exercise. We can go into rehab room, etc.
Sounds good to me. Yeah. Anyone want any, please either email me. Everyone should have my email, or send me a WhatsApp. For those of you who don't have my WhatsApp, maybe I will give you it so that you do.
WhatsApp?
Yeah, so it's +44 795 239 686.
Doing all right?
Drop me a WhatsApp with different conditions and we can address them during our next webinar, which we will focus and tailor make more to specific conditions.
There's one point that I want to make, and it's very salient in that people don't feel it because there's no heat. So you saw the data. You saw that people got better. We know that. Anybody who's bought the laser knows that they get better. More so than that, not only do they get better, but they feel better. However, they don't feel the process, meaning they don't feel the friction. They don't feel the heat. They feel the before and after. So it's incumbent on all of us as practitioners to always test, get a baseline, treat, reassess, which I didn't do here, which I'm happy to show you. So you want to treat, you want to assess, excuse me. You want to treat, and then you want to reassess. So movement, tone, always check to show, and you have to realize, explain to people, you will continually feel better, because if they feel better, they may not attribute it to your treatment. They may just think it was supposed to happen, because everybody where I live just takes such fabulous care of themselves. With a sardonic grin, I'm saying this. And they take all the credit for the outcome when they really don't understand the mechanism. So I do believe it's very important to let people know they're not going to feel it, but they're going to see the difference from the starting point to after the treatment point. And for you as a practitioner to please try and document that and always allow us to communicate. One of the bigger complaints that we have where we are is with a lot of other types of practitioners. Nobody really explains what's going on. No one spends the time. You've got the tool. I'm getting out of your view. You've got the tool. Don't overcomplicate it. Get the frequencies in, set it. Remember, it's always as simple as Simon says, 1, 2, 3. Point and shoot, passively have them move, help them move passively, actively help them, and then of course, always upregulate the brain with a proprioceptive feed. If you follow those very basic steps, no matter how complex the patient, no matter how complex the condition, you're always going to make an improvement, and you may actually make an indelible mark on their health by applying the low-level laser to the various conditions that we just mentioned. So do we have any other questions or requests?
No, but I'll give it a minute just to see if anybody has any. If not, we can wrap it up. But yeah, you're quite right. Honestly, I get feedback from doctors all the time that say, you know, each laser session does build on the last, and patients see improvements every single time they come in.
Right, and those slides, those graphs were very evocative in that they really showed that over duration of time, once you got the body's healing process into motion. So the theory for chiropractors and the like practitioners is we all want to allow the body to heal from the inside. We believe that the body has its own mechanism to heal. We're just using these tools to stimulate that fire, if you will. And laser is one of those innate objects. It's taking sunlight, it's taking different wavelengths and applying it to the body to allow it to heal. So I think it's a beautiful fit in all the people's practitioner toolbox, if you will.
For sure. Just one quick one. I know this isn't to do with musculoskeletal pain. However, how can you quickly improve sleeping patterns?
You said sleep, correct?
Yeah.
Sleep and something or just sleep?
Sleep patterns. So yeah, I'm assuming just sleep in general.
You know what? Great question. It was just a question that was asked this Sunday. How funny. The last question before we closed the day. So the sleep pattern, we had a brain treatment. We apply it to the brain and we apply a frequency of 11111, 6 ones right across the board. Delta has a beautiful way of helping, and we do that for 5 minutes. And then we do 1, 20, 40, 60, 40 to get some of the theta waves, and people have a great sleep. So sleep will improve. Also with sleep, there's some nutritional formulas, melatonin coming to mind, theanine also, GABA and the such. If you mix that with your nutritional protocol, again, you're going to get better sleep patterns, and most people have disturbed sleep.
Perfect. Thank you so much. So any questions after the end of this, please just send us an email and we will go through that. But yeah, keep an eye out for your emails and we will send you the part 2 registration link. Thanks everyone for joining, and enjoy the rest of your evening or day, depending on where you are located.
Thanks for your time.
Bye.